Hi, I'm Brenda Chase with Tuomey TV, and today we're at the Bell Women and Infants Pavilion with Kim Gardner. Hi Kim, thank you so much for being with us today.
Thank you.
Now, when someone is just finding out that they're pregnant, tell me what they need to do about getting started with their process with Tuomey.
Okay. First of all, they need to find a good doctor. We have several groups here in town that take care of the women when they're pregnant. We have Sumter OB, which has 4 doctors that deliver here. There's also some OBGYN and Associates of Sumter, and that's Dr. Anderson, Dr. Pauline Anderson. And we also have the Sumter Family Health Center, which has Dr. Carol Allen and several midwives there. So they need to find a good doctor. Once they find their good doctor and go through their prenatal care, it's so important to get prenatal care. A lot of women don't do that. It's very important. And then in about their 7th month, they can come here and start taking prenatal classes.
Wonderful.
We have lots of different classes to offer. We have the labor and delivery class, baby basics, breastfeeding, car seat class. We do friends and family CPR. We do something for the siblings. So if you're coming in and you have older children, I go through a class that we can kind of teach the older kids how to change diapers and load up the diaper bag and have fun with that. So different classes, and in those different classes, there's different lengths of classes. We have a 6 weeks class that we offer to some people who want a more in-depth study of what's going to happen in the labor process and the whole pregnancy process. And then there's the a 9-hour or 8-hour Saturday class, childbirth retreat.
Right.
It's a great refresher for people who've already had children maybe a few years ago and just want to catch up on some current things, or somebody who just doesn't have the 6 weeks to do the other class. They come in one day, one Saturday, and done. Or then the other classes are just 2 hours and they meet monthly.
Now tell me a little bit about the nursery. I understand you're a level 2 nursery here at Tuomey?
We are. We're a level 2 nursery, the only one in the Tri-County area that's a level 2. We can take care of babies at about 34 weeks. And with some issues, if they needed oxygen, if they needed IV medicines, things like that. Anything else, we would more than likely, if they're real sick or real early, now we usually ship them to Richland Memorial, and that's where they take care of our babies there. And then sometimes our babies will go to Richland and then come back here to us to continue to grow and feed here, and then we'll discharge them from here to home.
Wonderful. Now I understand you have a beautiful labor and delivery area.
We do.
Gorgeous.
We do. It is, and it just looks like home. It's a very homey atmosphere. A lot of people are into the whole home birth and all that new age of doing things more natural and more at ease and all the comforts of home. So we've tried to give the comforts of home here with the security of being in a hospital setting.
Wonderful. And then the recovery area is just as pretty. I know you have a new building here.
The Women's Center. Yes, it is. It's very nice, very nice. It's, again, just the comforts of home. We're going to treat you like your family. You're here, you're in our house for a couple of days, and so it's a nice place for moms to recover and rest and try and catch up on some rest before they go home and take on the task of raising these babies.
Wonderful. It sounds like you have a great program here at Tuomey. Tell me a little bit about the staff. I know you have a wonderful team of experts here, some educators, some nurses that take care of the babies.
We do. All of our labor and delivery nurses are now certified, and our nursery nurses are all ACLS certified and now in NRP, neonatal resuscitation. So everybody is up to date on their certifications, and also we know how to handle emergent situations. But they're also all very friendly as far as breastfeeding. We have a lactation consultant here who helps with that, but on top of that, our staff is very pro breastfeeding. So when moms are delivering in the labor delivery unit and they want to nurse the babies right after they're born, we have the staff there that helps them get that stuff going, and then the nursery staff reinforcing that. And that's a very big issue for new moms, is the moms who are wanting to breastfeed being able to have somebody there to support them and answer their questions.
Well, wonderful. Well, it just sounds like y'all have a great team up here, and I can't imagine why anyone would want to go anywhere else.
I can't either.
Thank you so much for being with us, Kim. We really appreciate your time, and we enjoyed our visit. And please join us again next month for more of Tuomey TV. Thank you so much for being with us today.
You're welcome.